Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a program director in internal medicine residency program and also an associate professor of medicine, chief medical officer. So we've been doing series of lectures to make sure you score very well in the in-service training exam. Again, I'm going to say again and again, if you're an internal medicine resident or any resident in-service training exam, you have to take it very seriously. Okay, with the high scores, you will impress everyone. You got a great recommendation letter. You will end up in a great fellowship also. Again, so let's talk about today's topic. Again, we were doing on nephrology now. Nephrology topic, high priority. A lot of people get it wrong. Is diagnosis of ecstasy-related hyponatremia, ecstasy or MDMA. So that is the thing. Today's topic. Okay, now we have a STEM with the questions. A 27-year-old homeless woman admitted with altered mental status. You got seizure, increased thirst. Sodium is like 133. Okay, so in this patient, blood pressure is high, tachycardic. Again, hyponatremia. A 27-year-old female, altered mental status. Which of the following is the most appropriate step? You got detailed history, physical examination, lab finding, or combination of detailed history, physical examination, and laboratory finding. Okay? Now, the question is about ecstasy can cause hyponatremia, my friend. That you need to know. Okay? So when you think about ecstasy causing, when you let's look at three parts. First part, we're going to look at the clinical history and physical examination. In the clinical history, you're going to see females are very, very prone to have this hyponatremia related complications. They think because of females produce estrogen, that kind of contribute to the ABP formation, okay? But it's a different part. So if I'm writing a question, I'm always going to put, is it MDMA related hyponatremia? You will see only females, okay? But again, it doesn't mean males could also get it. So you look at the clinical examination side and the history, you'll see nausea, vomiting, headache, seizure, altered mental status, excessive thirst. Those are the clinical finding, okay? Now, if you look at the pathophysiology, you need to know two things. One, there is increased ABP secretion. That's the one you will have hyponatremia. The other pathophysiology is what happens is like when people take this ecstasy, there's like hyperpyrexia, people feel extreme thirst. So they will have when you go to these places where they have a place to hydrate these people, so they drink lots and lots of water. We talk in these people with those thirst like 2 to 3 liters or 3 to 4 liters. So two pathophysiology you have to remember. One is increased ABP secretion. The other one is increased thirst, which is, you can say, psychogenic polydipsia. Okay, so those are the main pathophysiology. Again, increased ABP and then increased thirst, lots and lots of fluid intake. Okay, now what will you see in the lab? Of course, you will see what? Hyponatremia. Okay, serum sodium is like less than 135. Plasma osmolarity, pretty much similar to the picture of psychogenic polydipsia. Plasma osmolarity could be less than 280. Urine osmolarity is less than 100. Urine sodium is greater than 30 milliequivalent. Again, this diagnosis, mainly you have to get it from the history and the clinical examination, a little bit of the lab findings. So the answer to our STEM question, let's go back. And the question, a 27-year-old homeless woman, altered mental status, hyponatremia. The most appropriate test is a combination of detailed history, physical examination, lab finding. So you need all of that, especially the history is important. Okay, again, I'm just going to summarize. One, remember the link, female, ecstasy, hyponatremia, triad. Okay, And then you have to know the pathophysiology. Ecstasy increase AVP secretion by the drug, by ecstasy causes increased secretion of AVP, which causes hyponatremia. And also ecstasy causes excessive thirst, and people start like loading with a large amount of water, and then that can you can call it psychogenic polydipsia, and that can cause hyponatremia. Thank you so much for watching. We'll be back with another presentation.